We'll finish out the reproductive system with a discussion of the external anatomy. And again, much like with internal anatomy, the male and female structures are initially similar. And again, that's because they're all derived from the same embryonic structures. So both males and females, we see a genital tubercle, which grows out from the mesoderm that's adjacent to the urogenital sinus. Okay, and by way of reminder, the urogenital sinus is essentially a portion of the hindgut, and that's why it's in yellow. That's how the book has coded it here. The genital tubercle is going to end up becoming the phallus in a male. Okay. Now, the phallic segment of the urogenital sinus, which is so named because it's closest to the future phallus, that's going to extend or sort of lengthen along the genital tubercle, and it's going to form what's called the urogenital plate. From there, we're going to see mesoderm on either side of the urogenital plate that it's going to expand to form what's called the urogenital folds, which are ultimately going to meet together, merge, and fuse with the genital tubercle. Or tubercle, I think. This is one of those words that I read, but I don't hear pronounced very often. At any rate, this next slide is really all about the different kinds of folds we make. So the mesoderm near the anal membrane is going to expand and form the anal folds, and then we get labioscrotal swellings, which are developing on either side of the urethral folds. All of these structures will go on to have a purpose in both males and females, although of course a different purpose. Now this is all occurring sort of through week 7. After week 7, we do start to, and actually in a couple places before week 7, we start to see anatomic differences between males and females. But they're not differences that can be detected, certainly not by ultrasound, until 12 weeks at the earliest. And a lot of sonographers are not going to be willing to call it at that point because it's just too difficult to see to be sure. Most sonographers will tell you have to wait to 18 to 20 weeks, which is the standard time to look at baby's anatomy, to tell if it's male or female by ultrasound. We've talked about ways to figure it out without ultrasound that can be done earlier, and there are going to be some babies where things are reasonably obvious and reasonably clear and easy to tell earlier in pregnancy. Although, again, a lot of times that's just not possible, or the sonographer is just not willing to call it because initially the structures do look very, very similar. Okay, so in addition to the development of these structures, there's development of associated structures that hold them in place, that keep them where they're supposed to be, so that ovaries aren't wandering around the abdominal cavity. There are 2 ligaments. They exist in both males and females. There's the cranial suspensory ligament, and that's essentially sort of suspending the gonads and developing reproductive system from the diaphragm. So it runs from the reproductive system to the diaphragm. Then there's also the wonderfully named gubernaculum, and that does sort of the opposite job. So it attaches the gonads and the internal reproductive structures to the peritoneal floor, so it comes up from the peritoneal floor to merge with the developing internal reproductive structures. The gubernaculum is important for getting gonads to descend, both ovaries and testes. Both of them will need to descend, although clearly the testes have further to go. And again, remember, all of this is occurring bilaterally. So both of these ligaments exist in duplicate on the other side of the body. All right, so the formation of inguinal canals, which are slightly more interesting for males than for females. But essentially what you get is a region of the peritoneum that surrounds each of the gubernaculum, and that region begins to grow downward. It becomes what's called the vaginal process. So it grows downward into the abdominal wall, and that creates a space essentially, which becomes the inguinal canal. Okay. Now, in males, the inguinal canal, okay, is where the testes. I apologize, I moved too fast through that last slide, but if I start over, I have to start the whole thing over, and we're just not doing it. So, into the inguinal canal, the testes are sort of pulled down into that space that's sort of opened up by the vaginal process. Okay, so focusing on male-specific differentiation. In week 6, okay, so again, too early for us to see the difference by ultrasound, but in week 6, a urethral groove forms on the urogenital plate and then is enclosed by the urethral folds, which sort of come around and merge together. And enclosing that groove creates a tube within the penis, which is the penile urethra. So it's the section of the urethra that runs through the penis. Now, of course, this can go wrong. Everything can go wrong is sort of the lesson we learn from embryology class. Um, and so what can actually happen is you can have urethral folds that don't fuse, and they can actually not fuse in any of a number of places or in all places. And when that happens, it's called hypospadias. Um, and this is one example. Your book produces a couple of examples. This would be a fairly minor hypospadias, easy to fix with a corrective surgery. There are others that are much harder to fix or more severe. And if the urethral folds don't fuse at all, essentially, or for a large portion of their length, that can actually affect the development of the penis and cause the penis to be underdeveloped because you don't have that fusion in place at the time when the penis should be lengthening. So hypospadias is a very common birth defect in males. Okay, so from there, the perineal region will also elongate. That's the space between the anus and the developing phallus. And then the labioscrotal folds fuse to form the scrotum. Okay. From there, the testes, again, we talked a little bit about this before. The gubernaculum is going to pull the testes into the inguinal canals and towards the scrotum. It's not just, though, the pulling of the gubernaculum that causes this to happen, as the abdominal organs, which are up above the testes, are also growing. They're pushing down on the testes, so they're sort of moving as a result of pressure from both directions. Now, this takes a while. It's not until the 9th month of pregnancy that the testes are fully descended into the scrotum where they're supposed to be. And as they are descending in, the gubernaculum in males is shrinking until by the end it's just a small ligament connecting the testes to the floor of the scrotum. Now, of course, testes do not always descend as they should because nothing always works as it should. And when they don't, you have a condition called cryptorchidism, which has to be one of my favorite words in anatomy. So in this particular case, crypt would be secret or hidden, and orchid would be testicle. So this is like a sneaky testicle. At any rate, they get stuck on the inside, and that's not good for testicles. This happens fairly frequently. 1 to 4% of all male births will have at least one undescended testicle, but it does increase your risk for testicular cancer and for infertility. And for infertility, the reason is temperature. The reason that your testicles, if you're a man, are on the outside, or are supposed to be, is because sperm don't develop well at the higher temperature of the interior of the body. But in the scrotal sac, the temperature is a little bit lower, sperm develop better. So for boys for whom the testicles do not ultimately descend, and I do believe they do wait a little bit before they go in and get them, because this is, again, a process that doesn't normally complete until 9 months. For some kids, it will happen naturally after birth. But if it doesn't, then they can do a surgery to move them into the sac, which will preserve fertility provided it's done before age 2. Okay, females again are different and a little bit simpler. So the external genitalia of the female. So the phallus, okay, that genital tubercle, is going to bend forward, and that's going to form the clitoris. Okay. From there, the phallic portion of the urogenital sinus is going to become the vestibule of the vagina. Okay, so sort of the entryway of the vagina. And then the urethral folds will become the labia minora. The labial scrotal folds will become the labia majora. So in females, of course, these folds do not come together and fuse, they remain open. In females, the gubernaculum still has a role to play. And what happens in females is it pulls the ovaries downward as it shrinks into this peritoneal fold, which becomes the broad ligament of the uterus, so more sort of structural tissue. But in females, the gubernaculum does not regress and disappear the way that it does in males. The inferior portion of the gubernaculum, so sort of the lower portion, becomes the round ligament of the uterus, whereas the superior portion, the sort of the upper portion, becomes the round ligament of the ovary. Now, why do we care about round ligaments? Aside from the fact that they hold things in place and keep them where they should be, if you have ever been pregnant, so if you are female and you have ever been pregnant, and you sort of had that pain where you were sitting and you stood up kind of quickly and all of a sudden something caught, something right above the top of your thigh, sort of running in the groove along the sides of your pelvis, and you felt like, oh, if you kept moving, you might pull or tear something. That's your round ligament. Source of great deal of frustration for pregnant ladies everywhere. Not why it exists. It exists to keep things in place. But when people talk about round ligament pain in pregnancy, that's what they're talking about. This is the round ligament. And now you know. You may not have wanted to know, but now you know.